Hi, I'm Carol Calabrese, a board-certified infection preventionist, and I'd like to take a few minutes of your time to briefly talk with you about considering the use of UVC disinfection technology. As infection preventionists, we've frequently implemented the use of different technologies to complement aseptic and/or sterile technique. A few of these things can be CHG-impregnated patches placed over the insertion site of central and/or peripheral lines. Some of you may have used silver-coated impregnated Foley catheters. You may also utilize a dressing with silver that is placed over the surgical incision site. Another thing that is used are securement devices for central lines and Foley catheters that also aid in the prevention of HAIs. Adjunct technologies help to offset human error. Doctors Richard Wenzel and Dennis Mackey have said, given a choice between relying on humans or technology, to go with technology. With anything new, there may be skepticism until research clearly demonstrates clinical effectiveness. Good environmental hygiene is important to the prevention of HAIs. The 2003 CDC Environmental Infection Control Guidelines, Section E, Environmental Services, provides guidance on cleaning and disinfecting of the healthcare environment. A 2010 supplement to those guidelines, Alice Gee and Philip Curling wrote about the options for evaluating environmental cleaning. The document also reviews the process of validation to evaluate cleaning effectiveness. Emphasis is placed on cleaning and disinfecting of high-touch surfaces, and further describes the importance of utilizing roles and responsibilities as to whom is to clean and disinfect each piece of medical equipment. Another 5 studies demonstrated that with improved cleaning, on average, a 40% reduction of MRSA, VRE, and anemia could be achieved. There are over 8 studies in which findings confirm that a patient placed into a room previously occupied by a patient with either MRSA, C. diff, VRE, or anemia has a 73% greater risk of acquiring that pathogen. In a 2015 issue of AJAC, Dr. Alpha and her team described replacing an environmental cleaner with an environmental disinfectant and achieved 80% compliance with cleaning. Their findings demonstrated a reduction of between 20 to 23% of MRSA, VRE, and C. difficile. Another study done by Ardata utilized improved cleaning and the use of a fluorescent marker in 10 ICU units, and they were also able to reduce MRSA and VRE. Yet, even with all the progress that's been made in environmental cleaning, hand-to-surface and surface-to-hand transmission is still occurring, leading to the transmission of these pathogens and the potential risk of an HAI developing. This is where the use of UVC disinfection technology is beneficial and complements good physical cleaning of the healthcare environment and high-touch surfaces. UVC disinfection first surfaced in the healthcare environment about 2010, yet it has been used in different settings for many years. In a 2017 issue of The Lancet, Anderson and his team were able to describe that through the use of using UVC adjunct technology, what they found was that in using this technology, they were able to lower the risk of acquiring targeted organisms. Multiple other studies continue to support the use of UVC technology as a method to further reduce healthcare-associated infections and the battle against emerging pathogens. After being in use in the healthcare setting for over 12 years, my recommendation is to incorporate the use of UVC robotic technology as an essential component of your environmental hygiene program. Thanks for listening.